Yo, what up? It's a tip of the week, and today we're going to discuss, are you having an issue referring out your patients? Well, if you're a doctor who's having those issues like I once did, this tip is just for you. Alright guys, so I'm Dr. Jared Williams. I'm a concierge dental surgeon, and what I do is I go to office doing implants, oral surgery, and IV sedation and coaching in your office. I've treated about 10,000 cases and I've been practicing for just about a decade. And if you are having an issue referring your patients out, get your pen and paper ready because these tips are just for you. Alright guys, so I was working with one of my concierge colleagues. He's a doctor that wanted me to come into his office and train him over the shoulder. And so when we were getting prepared to get ready for this case that he had, he sent me over the CT scan. I'm looking at it, I'm like, this is gonna be a disaster. But of course I didn't want to tell him simply because it's like, as the coach, I want him to learn his way through so he'll have the confidence in order to treat cases like these or boot them right out of his practice so he doesn't have to deal with them. Simply because he's either not ready to or he just flat out doesn't want to be bothered. And so when I saw this case, I'm looking at it and I'm like, man, this is a disaster waiting to happen. The CT scan was a great scan. I'm working everything up with him and he's super excited. He's like chomping at the bit and I'm like, oh my goodness, oh my goodness. So we go through the CT scan. I give him an idea of how long it's gonna take, what procedures need to be done, and then I start putting in the treatment plan. And he's starting to see, wait a second, this is a little bit above his pay grade. But because of his enthusiasm, he's just ready to rock and roll, ready to rock and roll, ready to rock and roll. I'm like, yo, slow down, Tiger. Slow down, buddy. But as we go through the process, he is starting to realize, whoa, I need to learn how to refer. Guys, if that is you, this tip is just for you. Let me remind you, anytime you're wanting to increase your learning, the patients from hell will come into your practice and guess what? They're going to have the money, the time, and the patience to get the work done. You know why? Because they probably ran from 30 other doctors and they're ready to be primed and ready to be treated by you. But don't take the bait. Don't take the bait. Oh my goodness, don't take the bait. So number one is this, be willing to refer. If you haven't been trained by a concierge dental surgeon like myself to come into your office and train you, or you haven't done a residency, or you haven't become proficient in the treatment that you're about to provide, don't do it. These patients will be the bane of your existence if you get greedy and want to move forward with the treatment that they're asking for. I know that you're really wanting to get started. I know you wanted to advance your career and move forward, but guys, pump your brakes. Slow and steady wins the race. I know it's not sexy, but it's consistent, it is predictable, and that's how you smile after surgery. Alright, so pump the brakes. Number two is this, be easy on wanting to advance your career. I'm almost certain if the doctor I was working with decided to take on that case, he would have pissed his pants or would have just been like, you know what, I don't want to do dentistry anymore because it was really just that challenging. Even when I saw the case, I was like, I'm good, I'll refer this out. And I've done 10,000 cases. And sometimes it's just not worth it. So when you see something like this and it looks too good to be true, or you're just super duper amped and ready to go, but you haven't had the training to do it, refer the patient out, okay? Refer them out. All right. Last but not least, this is a bit of advice that I got from one of the old heads that I would shadow and one of my coaches, one of my mentors. And this bit of advice is something that you need to have. And I don't know if I should tell you because this tip right here is really going to revolutionize the way in which you process dentistry moving forward. So I don't know if I should give it to you. Okay, all right, you ready? You ready? Are you sure? Are you taking notes? You better have a pen and paper ready to rock and roll. All right, I'm gonna give it to you. Good clinical judgment comes from practice. Practice comes from bad clinical judgment. Now I know you're like, what? Take your time, rewind it back, and then play it again. Good clinical judgment comes from practice. Practice comes from bad clinical judgment. If you didn't get it again, rewind it back, play it again. Rewind it back, play it again. Guys, good clinical judgment comes from practice. Practice comes from bad clinical judgment. Now, that is one of the terms and phrases I got from one of my old mentors, but it is so profound. If you're going to get proficient at anything, you're gonna do some bad things. But if you have the right training, you're going to learn and grow. There's a reason why they call it the practice of dentistry for a reason, because you're practicing. Now, you don't want to start your career off or be in the middle of it or at the end of it having bad practicing habits. The way in which you increase, the way in which you are training is get the help that you need or refer the patients out. Do some reading, get some training, and then that's how you'll smile after surgery. All right, guys, what I want you to do now is this. I want you to like, subscribe, smash that button to share it with one of your colleagues, because I know if you're a doctor who has an issue referring patients out, I'm pretty sure one of your colleagues are thinking just like you. And matter of fact, because my focus is the globe, I want the globe to smile after surgery, there's probably somebody around the globe that's thinking just like you. And so guys, what I also want you to do is this. Once you figure out the tip that is the one that you was near and dear to your heart, what I want you to do is put it in quotes, put it in the comment section so somebody around the globe will be able to literally smile after surgery because of what was resounding for you. All right, guys, I'm Dr. Jared Williams, and my focus is for you. Yeah, you to smile after surgery. Make it a great one.